Hello, it is my pleasure to welcome you today to Susan G. Komen's virtual MBC Impact Series event. My name is Casey Volpe, and I'm with Susan G. Komen's Community Education and Outreach team. The programming for this series is envisioned as a year-long conversation with attendees presenting new information and speakers each month. Today, our important conversation will focus on MBC in the Hispanic and Latino community. We have several featured speakers, including Tony Lee and Fanny Jackson, who are patient navigators here at Komen, and Ashley Fernandez, who is an MBC advocate and from our MBC steering committee. Before we begin, Komen would like to thank our sponsors for supporting the 2022 MBC Impact Series. Thank you to AstraZeneca for being the technology sponsor for this year's event. The virtual setting means that MBC patients, no matter where they live, can be part of this community. We also would like to thank our premier sponsors, Amgen and GE Healthcare, and our signature sponsors, Walgreens, Daiichi Sankyo, Sanofi, and Merck. The series is made possible because of the generosity of these sponsors. One more housekeeping note. While our speakers are talking, please feel free to post your questions in the Q&A feature in Zoom, and we will get to as many as we can. Toward the end of the programming, a survey link will be placed in the chat. Your feedback is very important to us and helpful for future program planning. By completing the survey, you will be entered into a drawing to win an Amazon gift card. Now, we are excited you all are joining us for today's discussion. I would like to introduce you to Tony Lee and Fanny Jackson. Tony Lee is a senior manager of patient navigation here at Susan G. Komen. She's responsible for the operational and day-to-day management activities and administration of patient navigation services focused on breast cancer patient support and coordination of breast care services. She has spent over a decade working in the nonprofit healthcare sector, gaining valuable experience working with and assisting underserved populations in various communities, gaining access to quality and affordable healthcare. She has strong passion for health equity and eliminating breast health and breast cancer disparities amongst the African American and Latino populations. Tony attended University of Pittsburgh, where she received a BS in psychology and is currently working on obtaining her master's in healthcare administration at Winston-Salem State University. She currently resides in Charlotte, North Carolina, and she enjoys spending time with family, reading, and traveling. Fanny Jackson currently serves as manager of patient navigation here at Komen, where she manages and supervises a team of patient navigators who focus on breast cancer patient support, coordination of breast care services, and identifies opportunities to continually improve navigation and related patient care services. She has over 4 years experience as a patient navigator with Komen and more than 8 years total in healthcare services, previously serving as a lead registered dental hygienist in a public health setting. She has been recognized as an oncology patient navigator certified general from the Academy of Oncology Nurse and Patient Navigators. She proudly advocates for all patients and has a special affinity for underserved communities. Ladies, the floor is yours.
Thank you, Casey.
Thank you.
And Gina, you can advance to the next slide. There we go. Thank you. So good afternoon, everyone. I am Tony Lee. And so what we'll do is we'll just walk you through a little bit and explain a little bit about Komen's patient navigation program. And then we'll talk a little bit about how you can access those services. And then we'll pass it over to Fanny, who will discuss a little bit more of the specific needs and questions and common barriers that our MBC patients and our Latinx patients face. So Komen's patient navigation program is a unique virtual model, and our patient navigators help guide individuals through the healthcare system after they've learned of a suspicious finding during a screening or they're newly diagnosed, as they're going through breast cancer treatment, or as they are living with a metastatic breast cancer diagnosis. And our patient navigators provide an individualized approach and support as part of a care team. And within our navigator scope of practice, we can help to identify barriers to care, and we come up with strategies or ways to address and resolve them. Our navigators often assist with barriers such as insurance. We research and facilitate access to local and national resources. We enhance communication with healthcare providers and provide guidance on securing needed emotional support and access to other care resources and benefits. And so we work with the patient until their needs are resolved and remain available to them if new needs emerge throughout their breast cancer journey. And on average, what we're seeing is our patients encounter at least 3 major barriers. And so we're often working with them for several months, communicating regularly with them and doing frequent check-ins. Our navigators are also a bridge between the patient and their healthcare team. And so we really work to help supplement the oncology, nurse, or social work navigation and seek to provide that holistic or wraparound care to the patient who may be lacking any navigation support. So I mentioned that our program is a unique virtual model. And so Komen Navigators, we work to serve patients anywhere across the United States. With a focus on linking our clients to the most appropriate navigator based on geography, cultural competence, language needs, or other areas of specialization. And we do serve quite a diverse group of patients. And just a few numbers to share: about a quarter of our patients that are currently being served through our navigation program are living with metastatic breast cancer. And about 15% of our patients identified as being of Hispanic or Latino ethnicity. And because our patient navigation model is patient-centered and individualized, this approach really allows us the flexibility to serve whatever specific needs a community may have, and in particular, those communities that are experiencing disparities. And this really, allows us to address the unique needs of the MBC patient in the Latinx community. And then with this individualized approach, our navigation program really helps to address, or really gets at, those social determinants of health, all those underlying factors that we know impact health equity and health outcomes. And in fact, evidence has shown that with patient navigation, breast cancer patients can initiate and receive proper treatment sooner. They're able to remain in treatment and improve their quality of life. And so I just wanted to share a few positive outcomes that we're seeing and being reported from patients in our navigation program. So 88% of patients reported Komen's navigation program helped them receive care faster. 92% of patients reported Komen's navigation program helped them continue care or remain in care. And 94% of patients reported Komen's navigation program improved their quality of life. You also see on that slide too, as part of the outcome, reduced cancer-related distress levels. And so part of our intake, not only do we do a barrier assessment, at initial intake, or when someone initially is enrolled into patient navigation, we're also capturing cancer-related distress levels. And we re-administer that throughout their breast cancer journey or upon completion of navigation services. And so, for example, what we may see is someone, initially enrolled, their distress levels are at an 8 or a 9. And then as we, continue to provide the navigation intervention and we're helping them to overcome those barriers, we're seeing those cancer-related distress levels come down, which is great. And since the launch of Komen's patient navigation program over the last 2 years, the program has expanded now to include 14 full-time navigators, several which are bilingual Spanish speaking, and we're serving almost 1,000 patients a year. Next slide, please. So here, is where we have a slide that speaks to Komen's Patient Care Center. And patient navigation is seated within Komen's Patient Care Center. And we have several other programs. We have our breast care helpline, we have Komen Financial Assistance, and we have our screening and diagnostics programs. And so we make sure that our Komen navigators leverage our own internal resources through our patient care center to assist patients with overcoming some of their barriers. So for example, and a patient can have touch points with any one of these programs. And it's a very easy process to be referred into navigation, and then we can also refer into other programs as well. So a common example is many of our patients may enter through our breast care helpline. And then from there, they may be referred to patient navigation. And then from patient navigation, we make sure that, we get the patient the financial assistance program. So it's really a streamlined process that we can make sure that we connect the patient to all of the programs that they may be eligible for within our care center. And so here, if you want to contact our patient care center, you can contact 1-877-GO-KOMEN or through our email at helpline@komen.org. Thank you. So I will turn it over to Fanny.
Thank you so much, Tony, for clearly explaining that. That was awesome. Well, some of the common questions that our Hispanic community, Latino community, MBC community does present with is a lot of, the basic questions as far as understanding their diagnosis, where they have specific questions even about, because even though some may speak English, and then obviously there are some that do not, there's a language barrier. Even if you do speak English, there could be, a lack of understanding of terminologies. So as navigators, we do help, bring some understanding to those, even if it's their diagnostics or reports. But we do, like Tony mentioned, our goal is to work in partnership and help support the medical team. So as navigators, any concerns that, our patients do bring, we help direct that and help bring clarification to either gaps of communications between patient and the care team. But some of the questions that patients are presenting with, and my experience with Hispanic patients have been some related to disparities and just lack of information maybe that has been provided to them. For example, I have had a patient that, was requesting some documentations and was directed to her patient portal. And in doing so, and she and I taken a look at how to access that information, she was able to identify that there were certain treatments that was in her treatment, but that was not shared with her. So it's also questions to help them, like, hey, one of the questions was, how do I communicate that? Is it okay if I ask questions to my provider as to why they did not, share this with me? Or even this is my treatment plan that was recommended. However, I have questions because of my culture, things that that I'm confident and feel a strong belief on, maybe not pursuing this and that. So again, reverting back to communicating with the medical team about why certain treatments were recommended to the patient, and then addressing those concerns and bringing those concerns, serving as a liaison between the patient and the provider. And then kind of making sure that there is a sensitivity and understanding from the providers themselves as to why the patient is asking those questions, and that helps to bring bridge that gap of communication between the patients and the patient. Will in some of my cases will be either more confident in either pursuing with the treatment or feel more confident in the decisions that they've made as far as for the treatment that they have selected or prefer to move forward with. Then you have other questions and concerns as like common barriers like financial assistance, or if I'm not insured and undocumented, what other financial resources are there for me, or are there any resources available for me? And we help to address those specific needs and questions. There are also some legal questions that do arise, and we work in partnership with Triage Cancer and different either local state partners. So we do help to bring some resources for patients with those specific questions and concerns. And we are interested. I'm really happy to be here because I do want to learn, and I want to know if anyone has any questions specifically about MBC, if they are, currently walking through that journey, to please share any questions that you may have, because we definitely, it's always an opportunity to learn, and anything that you may be walking through that's related to, concerns about MBC and something that we have not shared, please make sure that you, ask those questions.
Yeah, and just to piggyback a little bit off what Fanny just said, we definitely want to take this opportunity as well to hear what your unique needs may be, so that we can be able to better serve the MBC community as well as the Latinx community. So we're definitely interested in hearing, are there any concerns or needs that haven't been met yet, or you think should be addressed? Please feel free to share those.
Okay. Thank you to you both. Hang on tight, because I'm sure we're going to have questions. But I first want to bring on our third speaker today, Ashley Fernandez. Ashley was diagnosed with de novo metastatic breast cancer at the age of 31 in April 2018. She's a fierce thriver who has been living with MBC while being a full-time mom and mom to her daughter and wife to her husband, who's active duty Air Force. Ashley has been involved in Komen's public policy initiatives, was a speaker for Komen's MBC Impact series, and participated in Komen's Moments campaign. She has also participated in the Ohio Mets Parade and does outreach and speaks on behalf of several organizations, including YSC, Light It Up for MBC, and the American Association of Cancer Research. Advocacy gives her a sense of purpose and a community of other women going through the ups and downs of MBC diagnosis. She is always looking for opportunities to educate and empower others to advocate for the best possible healthcare. And I'm very excited that she was willing to come today and share some of those experiences with us. So having said all of that, Ashley, come on and share that story with us, lady.
Hello. Hi, everyone. Thanks for the wonderful introduction. My name is Ashley Fernandez, as Casey had said. I'm 35 years old, and I've been living with metastatic breast cancer for 4 years. My story is pretty interesting because I was 31 when I was diagnosed. Unfortunately, a lot of Hispanic women are diagnosed at later stages, and I was one of those. I was diagnosed stage 4 from the back, and when I first got diagnosed, it wasn't because of a lump or anything else. It was because I was having side problems. I had so many pains on my ribs and side that the doctors kind of just dismissed it. I was living in Alaska at the time, and I had fallen down, and it was just a throbbing pain, but we did x-rays and MRIs and nothing was ever seen. Later on, that was in November. This fast forward to March, there was a lump in my left breast. And when I went to the hospital, they said that I was too young for breast cancer. They said that the pain that I was experiencing was nothing. And unfortunately, we both know now that that was not true because I was diagnosed with cancer. I feel that it's really important for us to use our voices. I feel that it's important for us to speak up for what we like and continue to advocate, because if I would have given up with the first no that I heard, I probably wouldn't be here today. It's important for ladies and gentlemen or anybody to speak up for the best possible healthcare because we deserve it. We deserve the best, and it's important for us to advocate for ourselves. In order to do that, that means just asking your doctor like what it is. If there's a treatment option that's been presented to you, make sure you ask questions. You don't have to make a decision right at that moment. I know we have so many things going on, but it's important to pause, take a second, receive the information, and at that moment, you could either do research or what's another day going to do? You can go home and think about it and discuss it with your spouse, significant other, or a trusted circle. I feel that in this cancer journey that I've been on myself, people want decisions so quickly when we need to realize that the best decision we could ever make is one for our own decisions. It's important because I've also had an experience, like I said, I've been living with this for 4 years. I've had an experience where my port was infected and I caught sepsis. Unfortunately, because I'm a person of color, I didn't get treated as quickly as others. I had to go and fight for myself in order to get pain medication, which later came into this diagnosis of, oh, you have sepsis, oh, you have something else. This is why I think it's important for all of us to use our voices. If I can do anything today, I hope it's just to encourage you and empower you that you're worthy of all good things this life has to offer. And that includes your health. That includes the way that you want to be treated. That includes what you see your future to be. For me, that's quality of life. I'm at home full time with my 7-year-old daughter, and I've had to go and do some different treatments. I go to physical therapy 3 times a week because keeping my body healthy really helps me feel better. When I don't do that, I realize that it doesn't work. So, all in all, my story is one of just hope. I know it can be scary. When I was first diagnosed, I was given the life expectancy of 12 months to 36 months. And all I want to tell you is to keep hope alive. If you have hope and take it one day at a time, you can do this. And we can do this together. You're not alone. There's a community of people that want to support you. So please reach out and be supported. Also, if that was a lot, I apologize. I had some key points, but I started mumbling.
I just want to make a comment, Ashley. Your story is very powerful. And I think oftentimes what we see in navigation in our, Hispanic and Latinx communities, Ashley mentioned the fact of, having symptoms that were dismissed. And I think, with navigation, even though it wasn't necessarily immediately a breast lump, we want to make sure that our patients understand that, they should pay attention to their bodies. They know their bodies, and that we want to help enhance that kind of patient-provider communication for them to speak up and have a voice. So we definitely want to promote, advocacy within our patient navigation program that, no matter what symptom you are, you may be experiencing, please be sure to discuss it with your provider, and we can give them tools. In fact, Komen has great questions to ask the doctors, kind of pre-scripted, that patients can take with them to kind of facilitate that conversation with the provider. But I definitely want to emphasize, like Ashley said, it is important to, know your body. It's important to speak up when you're having symptoms. And then definitely, if you need the assistance of a patient navigator, we can help enhance that patient-provider communication so that folks can get diagnosed sooner with earlier stages, which have, better outcomes.
Yeah, Tony, I'm so glad you said that, because when I was diagnosed, I didn't know that you guys were out here. I didn't realize that until I started getting into my advocacy work, realizing that, hey, there's patient advocates. Like, I didn't have to go through this journey alone. And I wish that was something I would have had in my pocket, because I feel like these are just tools that we could put in our toolbox. And then even if we don't need it ourselves, we're able to share it with somebody else within our community, just in general, and it can continue to help all of us.
Absolutely. And I'm just going to jump in because as a Hispanic myself and helping that community that is so dear to me, I mean, I've been advocating for my parents since I was 6 years old as a translating. So I'm sure a lot can relate. Having anyone that's there to support you on your team, having someone call and advocate, like Komen or, any other group that we can try to find or locate in your area. Anyone on your team is going to bring that attention to, to your care providers, your primary doctors and the healthcare team. If they know, hey, and it sounds kind of crazy to even say it, that sometimes you may fall through the crack. The system doesn't always work, and to have someone that helps, because sometimes you're nervous, you may feel, I don't want to tell my doctor how to do their job. It's telling them that you're here and you need attention for yourself, because you're a person and you are valued and you matter. You have people that love you. And even if you're alone and you don't have family here, because we have a lot of, people that are immigrants, and especially in this time and age, know that you have rights. You
Yes.
have rights, and we are here. There are people, like Ashley said, that are here, and Tony, to help walk you through the process. As navigators, we care for you. We want to be here for you. We're here to support you and utilize our services as best as you possibly can.
I love that you said that, Fanny. I'm just going to echo on everything you just said, because a lot of times, especially in our Hispanic culture, we're told culturally, like, hey, the doctors know best. The people before us know better. And those are stigmas that we need to break, because honestly, we know ourselves. We know when something's wrong, and it's okay. You said we value ourselves, and we do. Like, it took everything went inside me to break that mold, to cast that, just jump out and be like, hey, no, this is not okay. And I'm just really thankful that I fought for myself. And I hope that all of you on this call will advocate for yourselves in that same way, because like Fanny said, you're worthy and you deserve the ultimate best. So if you're getting dismissed, find another doctor, get a second opinion, but make sure you have somebody in your court. And if you don't have anybody, find me. I'll help you. Like, Komen has resources. Let's do this, but you're not alone. And I love that we're just in here empowering the room, because I feel it over here. And I'm like, yeah. It says, does Komen have resources for caregivers? That's a question that came in.
Yes. In fact, Komen.org has a plethora of resources, whether you're, newly diagnosed, metastatic breast cancer diagnosed, but we also have resources available through Komen.org for caregivers, such as, support groups or, respite type care, because we know not only, the patient isn't the only one going through it. Oftentimes family members are going through it, and they want to help, and they're not quite sure how to help. And then we also want to make sure that they don't experience burnout themselves. So yes, there are resources available that we can provide to caregivers.
Awesome. I just thought of another question. If my mother or loved one doesn't speak English, but I'm not there to translate, as Fanny said, like, we've had to be translators, how can someone help her with her doctor's appointments? Do you guys have any resources for that?
Yeah, I'll let Fanny take that one.
So we do have resources. I actually have myself attended virtually with a patient that did not have anyone to translate for her. So, as a patient navigator and a Spanish speaking navigator, I make myself available. And we also do have a resource where we have a translation service that we, work with, that is available to all our navigators for any non-English speaking person. Obviously, now we're talking about the Hispanic population or community, but we do have it available. And just know also that doctors, offices are required to have translation services so that the patient is aware of, what's going on, and that understands their visit and what's being discussed. But yes, we do have resources that we definitely make available to our patients and caregivers as well.
Nice.
I think there was something in the chat too about if the patient navigators could share a little more closely how we work with the medical team. And so I just want to clarify that we are not clinical or licensed providers, but, oftentimes it could just be, contacting the nurse or the social worker and saying, hey, this patient doesn't quite understand their diagnosis. Could you, explain to them? Or, this patient says they're experiencing side effects. Again, being the voice for that patient sometimes when they're afraid, like Ashley had mentioned, sometimes in that Hispanic culture, like I said, there's the issue of questioning authority. But they're experiencing neuropathy, they're experiencing fatigue. So sometimes it's just us contacting the clinical team to say, hey, they're having side effects, could you contact the patient, or could you address those with the patient at their next visit. So a lot of it is just making the medical team aware of what's going on with the patient, and also letting them know that we're here to help supplement their care and not compete with them. So, but we want to make sure that we provide, that wraparound, that holistic approach for the patient so that they can stay in treatment and so that their outcome is better, and that their quality of life, like Ashley has mentioned, improves.
Okay, I got a question that just said, how do you communicate with your family about your diagnosis and what would you recommend with young children? So funny, I am a part of, well, not funny because most of us are Hispanic here. I have a huge family. I'm one of 26 cousins. My mom's the baby of 7. So our family is huge, and that's just my mother's side. My dad has like 7 cousins over there. But the way that I told them, I was diagnosed in 2018 and my daughter was 3 years old. The way I explained it to my daughter was more difficult than I did with my mother. So I'll explain from a children's perspective. What I told my daughter was, hey, mommy's sick and she's going to be sick for a little while. Like this little while is going to be a long time, but that doesn't mean that I can't be with you. I can't play with you. I can't do anything. Some days I'll be sicker than normal. Remember, she was only 4. Some days, 3. Sorry, she was 3. She's about to be 8. Oh my goodness. Guys, another miracle. Okay. So I would just explain, like the day that I got chemo in my port, it was really hard. So I would have to cuddle her on my left side, not my right side. And I would just adjust it and just let her feel and be a part of it as much as possible, because kids know more than we think. Kids already know what's going on. They just want the reassurance and to know. Also, there's camps out there and there's books on Amazon that I loved that says, there's one called Mommy Has Cancer, What Now? And that one was incredible because it basically talks about a little girl whose mom has cancer, but when the cancer didn't go away. So I would just say that my child now is resilient. She's going to be 8 next month. She's super empathetic, and she understands that I get cancer treatment and chemotherapy every 21 days. And it's like nothing. I'm still able to be her Girl Scout troop leader. I still volunteer at the school. I'm a little bit more, flexible. Like when I sign up, I make sure to note like, hey, if I'm not feeling well that day, I will not be there. So let's have a backup just in case. But I still try to be involved as much as possible. So I would say honesty, and just be as honest and bring it down to a language where they'll understand, because they don't need to know that it's a terminal diagnosis. They just need to know that it's something that you're dealing with and that you're going to continue to live with. Because what they see is what they understand. And if we show that we're okay and that, yes, like my daughter has seen me cry, and she's also been my biggest comforter, like, oh, what hurts? So I just think that that's actually helping her heart grow. As far as my mother and my uncles, we're very religious. So we just pray. We pray, like, we know that God is able. And even though he hasn't completely healed me, I know that I will be healed either here on earth side or when I get to heaven. So for me, that's how I deal. And that's how we communicate as a family. Like, yes, it's sad, but honestly, just take it a day at a time. The best advice I've ever gotten, and this was from a fellow thriver that's been living with this for 14 years. She said, Ashley, take this like child's play. When a child doesn't feel well, what do? They rest. When a child feels great, they go crazy. So just be like a child. Take it like a child, a day at a time.
I would like to actually add on that. I just had a patient not too long ago share. It was so amazing how it happened, because one week a patient called me and she was like, hey, I just wanted to tell you that with the resource that you gave me and some support, emotional support, they mentioned, because I was having a hard trouble just like communicating not only with family, but friends and everybody texting and emailing me. And they gave me this great idea to just compose an email, and anytime that anyone would send me something, I would just forward that same email. That way I'm not repeating myself, because every time I repeat myself, I get exhausted. And so she would copy that email to everyone, or even in a text, she would do that. And she was like, that brought so much relief to me. And it's okay that I don't want to share anything at this moment, but when I'm ready, I do, extend out, my time and do talk to them. So just wanted to say that that's what worked for someone as well. And if you feel that that's something that can work for you, I just wanted to make sure I shared that.
I love that you shared that because a lot of people also have like little Facebook pages or little blogs so that they don't have to go individually and you just share it in like a group message and that's that. Yeah, whatever works best for you. I also got another question that says, would you recommend Hispanic women participate in clinical trials? I would, because we're underrepresented. No, that's not what I'm trying to say.
Underrepresented.
Thank you. That's exactly it,
Yeah.
Tony.
Yeah.
We are. People of color in general are misrepresented in those trials because unfortunately we're not even offered participation in them. So you need to find them, which is another thing that's a big issue in our community.
Yeah, and Komen can help, our navigation can help for sure. But by, providing education around clinical trials and directing them to, there's a clinical trials website where someone could find if there's one that, that's close by. And then from there, we can help, if we need, they usually have specific clinical research coordinators involved in that. But again, just, empowering the patient to be able to go to the provider and say, are there clinical trials available? Is there one that you think I may be eligible for? And starting that conversation. So Komen's navigation can assist with that, as well as direct to a clinical trials website where patients could find. But yes, it is important to have, our Hispanic patients represented in clinical trials
Yes.
for treatments. So.
I would also like to say just educate yourself on clinical trials as well, because a lot of people feel like you'll be a guinea pig and that is not the case. So I would urge you to look into it and just do a little bit of research because you are given a medication that's been fully tested. And even if you don't get into the trial and you get like the first choice, it's still a standard of care. Like it'll never be less than. So look into that and make sure that if that's something you'd want to do, research it because there's plenty of opportunities and lots of options. Nice, Rosalind. That's awesome. You're working getting the word out. Oh, there was another question on here, ladies. Can a patient navigator help me talk to my family if I need that support?
Annie, you want to take that one?
Yeah, I actually have not had the experience or the request, and someone reaching out and saying, help me speak with my family. But I mean, we're not licensed counselors, we're not social workers. However, we can help the patient with, formulating maybe just before, because sometimes they don't know how to communicate to the family. So it's just a matter of like, okay, what would you like to share first? So it's just kind of like talking to them one-on-one first. What would you like to share? And if just the same way as we would advocate for them on behalf of them to their provider, I would feel comfortable enough to be able to share the same information that she's trying to communicate in a way that is more relaxed for her, in a way, or him, right? Because both men and women are affected by breast cancer. And to also, let the providers know that the family has questions, and the family has, would like to know more, because then the nurse, they may have a team or they may have a social worker, that can provide those services and provide more information to the family. And another thing is that sometimes, it's so overwhelming when you go to your appointments. And there's another thing, how do you communicate, what your doctor is telling you, what they're sharing with you? Ask your provider, can I record? Is it okay for me to record our conversation so that I can bring that information back to my family? And, most times they are okay with that, so that you can bring that information back to them. And if you need us to, help facilitate that and help, have the conversation, we can definitely do so. A navigator can, but of course, we would like to verify if there is, or confirm and see if there is a licensed social worker, or if that is available through their facility, their healthcare facility, so that they can provide some additional support.
On this question of like sharing with your families, I feel like it's important to note that no matter how you share, it's okay because this is your story. This is your journey. So you can share as much or as little as you feel comfortable with. It's so important to validate that your feelings and how you want to move forward. The last question that came in was, how can you guys help patient navigators help Hispanic women with MBC?
I'll start. maybe. Well, one, I think, as Fanny mentioned, or as I've mentioned too, through our patient navigation program, we have several Spanish-speaking patient navigators that can assist to at least provide, resources in their language. We can assist, like you said, like we've talked about, in really helping to have the patient communicate with their healthcare team, particularly when you're talking about a language barrier. Our navigators, we often know too, and Ashley may be able to speak to this, the financial toxicity that comes with a metastatic breast cancer diagnosis. So we really make sure that we get the patient connected to, the appropriate insurance options that may be available to them, or if they're currently insured, we make sure that we optimize we educate them and optimize them about their insurance benefits. We work with them to find other, sources of financial resources in their community, as well as leverage our own Komen financial assistance. And I think as well, and Ashley, again, you can speak more to this about the emotional side of having a metastatic breast cancer diagnosis. It's also important that, that the patients are connected to family, that they are connected to community, that they have a support system. So we're able to, even provide information for support groups. And I know in several cities, there are definitely support groups that are more tailored towards serving Spanish-speaking Hispanic women. So again, getting that culturally competent care that's necessary. And I think, too, our navigation helps to just kind of break down those barriers. Again, that comes sometimes, what I've experienced in the Hispanic community, that stigma of having a cancer diagnosis, just kind of breaking those barriers down, that it's okay to ask for help, that it's okay, that someone is there to help you navigate throughout this journey. And like Ashley said, you can be as vocal as you want about it, or, you can keep that to yourself, but have someone in your corner. So whether that's your family, support groups, or navigators, it's important to have at least someone to help guide, through this journey.
Yeah, and then I'll just piggyback on that. And like Tony said, as far as the insurance options, we do help with the disability, and if they need anything related to, appealing anything as far as with insurance or with even the insurance company. And then I want you to know that, sometimes we haven't run across a specific need and it'd be new to us. And at that point, we work in partnership with local organizations, state organizations. We do everything that we can to try to get an answer. We don't have an answer to absolutely everything, but we work fiercely to, Tony can definitely tell you, we work as hard as we can to try to find those resources. We've worked with, in getting resources for domestic violence, because we know that even though you have a metastatic diagnosis, life was still happening before that disease. So there's a lot of other, barriers that were already there prior to. So we help, and that's the difference between, navigators, our Komen navigators and any other patient navigators from the clinical setting, is that we help to address those needs that are going to pretty much be in the way of you continuing your care. So that's how we would help you and support you, not just in your clinic, with your disease and with your care and your treatment, but also any other barriers that can be present themselves or that were already existing to help you continue your care.
I love it. Yeah, I love that both of you guys shed light on the financial toxicity, because having cancer is like a world of emotions already. And then adding in the stress of finances, adding in the stress of like living with your spouse and just everyday life on top of it, it can become overwhelming. So I'm so glad that you guys offer those resources as well as other things. As far as communities and support, please, please, please connect. I know it can be scary to get yourself out of those bubbles, but once I've connected, I felt like I kind of became a butterfly. Like I flew and I felt empowered, and I had people behind me that just really allowed me to fly. And even like I'm connected with Komen. I've been working with you guys for 3.5 years now. And had it not been for my friend Tori that had MBC, I wouldn't have been with you, because it's a community. You meet people and you just continue to grow, because we want to see everybody thrive and be their best selves. So I urge all of you guys that if you don't have a community support group, or if you want to start one, let me know. You can find me. And I would love to get you connected with other Spanish speaking women. I speak Spanish myself, not the greatest. I understand it 100%, but once you don't use it, it gets a little rusty. So it sounded a little rough, but I can do it.
All right, ladies, thank you for that amazingly informative conversation. Thank you for sharing your stories and your experiences. And we're so happy that you could join us today. We want to express our thank you as a program to Tony Lee and Fanny Jackson for their expertise, and to Ashley Fernandez of the MBC Steering Committee for her experience and story. Today's session was recorded and will be posted to our landing page soon. It will also be translated into Spanish, so you can rewatch this session or view previous sessions you may have missed. And please, please help us spread the word about this important content with your friends, your family, your healthcare professionals, anyone you think that might be interested. Once again, we want to acknowledge our sponsors of the 2022 MBC Impact Series. Their generous support allows us to continue to bring this community together to share this important information, these resources, and these experiences. So a very special thank you to AstraZeneca for being the technology sponsor. We would also like to thank our premier sponsors, Amgen and GE Healthcare. And last but certainly not least, our signature sponsors, Walgreens, Sanofi, Daiichi Sankyo, and Merck. The series is made possible because of their generosity. Please also help us by completing a survey, which you can find in the chat. Your feedback is very important and does help us with future programming decisions and ideas and angles, all of it. So by completing the survey, you'll be entered to win or entered into a drawing to win a $25 Amazon gift card. Finally, the next event in the MBC Impact Series will be on October 11th. The focus of that conversation will be advances in MBC research and technology, and you can register for it now on our landing page. And we look forward to having you log in and join the conversation. Thank you again for joining us. Thank you to our speakers, and thank you to all who made this event possible. Stay safe and stay connected.